Okay, so we finally got new equipment in Recess 1 for trauma-related situations. So this came about when we went to the training for ATLS. We discovered that we probably didn't have the appropriate equipment for certain situations. So I got these things for us. So you're going to have, so we have 3 pelvic binders. They're going to be in Recess 1 in this cabinet here in these red envelopes. I'm going to show you what it looks like. So it basically is a band that goes around the patient, and then there's this cinching device, which I'm going to demonstrate for you guys on how it goes on. In an ideal scenario, when you have a trauma coming in, you know they're coming in, and you know there's a potential pelvic injury, having this on the bed before the patient comes is going to be very useful. Otherwise, we're going to have to apply it to the patient. So anytime a patient has a multi-system trauma, so your ATV accidents, your car accidents, major falls, that sort of thing, pelvic injuries should be high on your suspicions list. And just so you know that pelvic fractures are probably one of the major sources of people bleeding to death. So it's a very serious and very important thing that we stabilize the pelvis if we suspect pelvic injuries. The word there is suspect. If, for whatever reason, you've got a trauma patient that you clinically think that there could potentially be a pelvic injury there, go ahead and put the binder on. Don't wait for x-rays and all that stuff. Put the binder on and at least secure the patient, and we can always take it off if they don't need it. But it's a much better thing to just put it on and make sure we're eliminating the risk for that time frame of bleeding. So Stephanie's going to go on the bed here.
I was moving.
No, it's okay. So one of the first things that I wanted to talk about when we have a trauma patient, so rolling a patient with C-spine precautions is something that we don't always practice and we don't always talk about, but there's actually, some very specific things. So there should always be one person at the head of the bed. Obviously, this patient should have a C-collar. If they do not have a C-collar, over there in the cabinet, we have C-spine collars. Any patient who has a major multi-system trauma should have a C-collar on, period. If EMS didn't bring them with one or they didn't come by EMS, throw a collar on your patient immediately, because it needs to happen. There's stuff on the internet on how to put them on. We'll actually do that in a separate video if anything. I want to do the pelvic videos for now. So, person's going to stabilize the head when we roll. So the best way to do it is actually to have your hands on the shoulders here and secure the head with your forearms when you're rolling the patient, and that really sort of helps stabilize that head when you're doing the rolling. So the people on the body portion of things, so Margaret's going to join me here. So we're obviously going to decide to roll on one side. Normally one of the clinicians is going to be on the opposite side because they're going to want to do a spinal assessment while we're doing this maneuver and while we're taking the time to do all this stuff. That person will also want to have access to our pelvic binder to apply it. Okay, so what we're going to do, so Margaret, you're going to come on this side. I just want to make sure that we cover the rolling of a patient. So when we're doing C-spine precautions and we're rolling somebody, it's really important that we do it all in one maneuver. And one of the techniques that really sort of makes sure that you're not sort of twisting and bending the patient is the person at the top will reach over and grab at the hip and bring this arm over and at the shoulder. The person beside you is going to actually cross over. So you're going to cross over and you're going to grab at the legs. And that way when we're doing this, we're actually doing it in one nice movement. So we're going to go 3, 2, 1, roll. And then we're going to roll. And somebody's obviously going to be holding the head there, okay? While the patient is rolled, somebody's going to be assessing the spine for any step-offs or injuries there, right? The C-spine collar is already going to be on, but we're going to be doing C-spine protection. The pelvic binder, okay? So you basically put it under the patient. You can sort of stuff it in there if you want, or you can accordion, sort of fold it until it's the right length, because it's actually quite long. It's designed for multi-sized patients. And you want the edge of your device here, which is already on there, you want the edge of the device to be sort of close to the edge of the bed as much as possible. And then once we've done that, so we're going to roll our patient back over. Obviously a second person would be used for that purpose. and then we're going to reach through and pull the rest of that material out. Okay? Once we have that under the patient, now if I do this, I'm not securing much of anything, right? So in my placement, I could have put it right at the pelvis when I put it on, but I wanted to show you guys, if you do have a patient where it's up high and you need to bring it to the right level, so you can actually have your partner on the other side. And what you're going to do is you're going to scissor back and forth to try to get it underneath the patient as much as possible. Again, trying to be as cautious as possible about shearing forces. But that technique will usually work. If not, then you may have to sort of re-roll your patient and try to get it on. Sorry, Stephanie, I'm a little personal there. So you want it to be sort of even with that the pelvic crest there as much as possible. Then we're going to bring the device over. So normally, it's a one-time use thing. I would cut this, and then I would just apply to the patient. If you don't have access to scissors, you can fold it onto itself and try to center it as much as possible. Okay, you're going to want a space between the two pieces, so we're going to sort of adjust a little bit. And we're going to go right about there, and then we're going to bring it over, and we're going to just Velcro that piece to the other side. Okay. Then this device here, so you actually, it's Velcroed onto the binder. Mm-hmm. You pull it apart, and then you're just gonna apply tension. And Steph should feel that, right? If your patient's conscious, you're gonna wanna explain to them that might hurt a little bit. You might wanna give them some pain medication. Let them know to, let you know when it feels firmly tight, okay? Once you've got it nice and firm, you're going to grab your ropes, and there's these little loops here, so you can just secure it with the loops. And then once you've got them secured in the loops, you can just put it back on the Velcro, and that's going to be nicely secured. So a couple extra pieces here. Once you've got the binder on, you'll notice that there's actually a little paper section here. That is to put the time and date of which you applied the binder. So this is physician dependent, but check in with your physician and ask them if they want you to release some of the tension on a regular basis, because obviously this may be cutting some of the circulation to the lower body, and we may want to restore that on at periods. So your physician can actually instruct you in that aspect, and then you can come along and you can just relieve the tension for a few minutes. Make sure you got good circulation, do your assessment, and then pull it again nice and tight. Again, with an awake patient, that may not be a very fun thing for them, so it will be very patient specific and physician specific, but that is something that you must keep in mind. And that's the application of a pelvic binder.